Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Hank, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad and I
Bob.
have this thing before we start. We always try to get our energy levels up. So we want to be ready for our subscribers.
Yeah, we're gonna perform something someday.
Yeah. Today, Brad, we're going to talk about the Tom Brady method to treat shin splints. Now, he didn't specifically come up with this method. We're borrowing from his book.
Sure.
Which let me give a little plug for this.
Looks just like him.
Yeah. For those of you who don't know who he is, he's a football player, plays for the New England Patriots. He's a quarterback. He's won 5 Super Bowls.
Yeah, he's good.
But probably the most amazing thing about him is he's 40 years old and he's still performing at a high level.
Sure.
And he attributes it all to this workout that he does. It's called the TB12 workout, Tom Brady 12.
Sure.
It's based on 12 principles. Anyway, one of the things that he really emphasizes, Brad, is, I bet you he says it in his book 1,000 times, muscle pliability. So not just stretching, he's trying to get the muscles soft and pliable. And because it makes sense, Brad, especially when we're talking about shin splints. You have all these bones that on the lower here, you have all these muscles that attach into the bone down here. And if they're tight, they're pulling on that bone, Brad. And with shin splints over time, it actually irritates the outer bone surface, the osteum, and it actually can inflame that. So it's very important that the muscles going around the lower leg here are very stretched out and pliable.
Right.
And that's what we're going to show you today here.
And that makes a lot of sense to me because I'm thinking when they're pliable, they're more relaxed, better circulation.
That's it. He makes that point. Better circulation, they work better. They're
Right.
better, higher performance is what he's saying.
And that's what it's all about, particularly in his job.
Yep. If you are, by the way, Brad, if you are new to our channel, I know you aren't, but if they are,
Well, yeah, there are.
if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook. We know it's Facebook, not the Facebook.
I like the Facebook.
Yeah, and well, like us too. Instead of just us liking Facebook, please come over and like us. We'll promise that we'll perform at the highest level too, just like Tom Brady.
You're a natural, Bob.
Yeah.
Just segued right into each other.
All right, so we're talking about shin splints here. And have you found, Brad, that when you get something, like if you get a certain problem, that you become much better at treating it?
Oh, right.
Well, I've had shin splints.
Okay.
So, in fact, I was just starting to get the start of them again, and usually what happens is when my shoes are getting wore out too much. So I got new shoes, but I was still getting a little bit of it on this side. So I started doing some of these things, and I thought it's been helping.
Okay,
So,
let's show them what we can do.
well, first, you know, the one thing that I did this morning is you're going to start doing, and there's a lot of different ways to do this, but you know, there's also 2 types of shin splints. There's the ones that are on the front,
Okay.
and there's the ones on the back.
Okay.
I'm getting the ones on the front right now,
Right.
and that's the more common one. And what you can do, well, in the morning, and by the way, Tom Brady, he dedicates 20% of his workout time to muscle pliability. So it's important to him.
So he's working some kind of massage or soft tissue
Mobilization,
mobilization.
yeah.
Okay.
So what you can do is you just get your foot up like this, and the muscles run right along here on the outside of the tibia here. So you can just take your thumbs and work the muscle going up, usually towards the heart. But what he does along with that is he actually has the muscles contract
Okay.
and relax at the same time. So you can actually bring your foot up while you're doing this. See how I'm tapping my foot almost basically, Brad? And I'm working the muscle as I work up.
Okay. Sure.
Now you can also use some lotion on here,
Yep.
non-sticky lotion to help you. Yep, there you go. And Brad's using his fingers, and that's another way to do it.
Well, this way I can actually pull up while I push in, because with your thumbs, it's harder to get
Yeah,
that
it's
angle.
you're gonna figure out which way you like it.
Yep.
You can actually do kind of a circular motion even
Sure.
with this.
Yep.
You want to get all parts of the muscle. You want to get the inner side, outer, way out. You want to get all parts of it. So you can also.
And how much time are we going to spend on this, Bob?
Well,
a couple minutes, or
yeah,
till your fingers get
I would
tired?
say generally, if you're not having problems, you can only do it for like 20 seconds. I mean, you can just quickly go up it and
Sure.
do it once. if you're having problems, I would go until it feels like it's kind of softened up.
Right.
And switch maybe a couple minutes. I did it for a couple minutes this morning.
Sure. Okay.
And I don't know, again, I don't know if it's psychological but since I've been doing this, but I just feel like I'm springing better when I run.
Well, I noticed that when you walked in, Bob.
Yeah,
You
I
were
just
bouncing like
springing
a
my step.
kangaroo.
So, and obviously, again, you can work the back of the muscle too if you have shin splints in the
Right.
back. So more in the calf.
You got to get pretty deep back in there because you're
But
working
the same
through.
thing again, you're tapping the foot, Brad, while you're doing it.
All right,
So,
so maybe play some music while you're doing it.
there we go. Tamp down races, sing this song. All right. The other thing that to me would make this a lot easier is if you did get a pure wave massager. And I'm not trying to say you need to get one because this works just fine.
Mm-hmm.
But if you are, one prone to injury, we're big fans of this. The pure wave provides percussion, so it really digs in there.
Yeah.
And this is just a lot easier, Brad, to do this than to do it yourself.
Your fingers don't get so tight.
Right. And now you can use this on your whole body. You can do it in hamstrings. You can do it,
Sure,
you can
sure.
to get optimal performance. It's just a lot easier to do it. They have different attachments. I like the pointer one, the pointer stick, but they have one that's air-filled. And so if it's too much for you to start off with, you just put the air-filled one on, and you can see it just squeezes, Brad. It's real
Right.
soft.
It
So-
spreads out the force a little more. It's more broad, a little soft. But I was thinking this one, if I was going to do it, I would try this. But I'd try both, actually.
Yeah,
And see which
one.
It really
works
depends
best.
on what phase of the injury. If they're pretty tender, maybe that one, the pointed one, would be a little aggressive. But it's easy to figure out.
And if you want, you can heat it up before. By the way, he recommends you do this before the workout and after the workout.
Okay.
I mean, again, if you're having trouble with shin splints, you understand it's
Yeah.
not a minor problem. My son runs in college, and he had to stop because his shin splints got so bad.
Well, you can't run with them.
So,
not
no.
fast.
Do you want to show the foam roller, Brad?
Oh, I do.
Another way to do it is you can use a foam roller.
Oh, you want me to show him using
Yeah.
it? You're killing me,
He's
Bob.
a funny guy. He's a funny guy. Maybe you don't see it, but
So what I'm going to do to get on the anterior tip, I'm actually going to point my toes in just a little bit so we're not rolling on the bone itself, but we're trying to get to the muscle. And if I'm working one leg, I'm actually going to turn this way, and I can get more to the lateral side of the muscle.
And again, if you're going to be a purist, Brad, you would start distal.
Yep,
And
I'm-
I mean, if he wants to go through the heart,
And
and
I'm
see
gonna-
there, yep, how he's dorsiflexing the foot and he's working that muscle at the same time. That actually works out good, Brad, with the one leg like that.
Yeah, and I've got good control. And again, I'm going to go back up to here and then start over.
Yep.
So we're going. I'm not
Towards
going to
the heart.
Yep. I'm not going to go this way and do it because that pushes the blood the wrong direction.
Do you want to show the calf too?
Oh,
I mean,
yeah.
the posterior.
Yep. Posterior.
This would be the posterior tibialis.
This is one of my favorites. Okay, so again, we're going to start by the ankle. I'm just going to do it on one leg right now, or you could do it on both. And I'm going to work that plantar flexion with my toes going up and down, and I'm going towards my knee. Once I get to here, I'm going to back up. Now, if you want more aggressive on one leg, if you cross like this, that will definitely get more aggressive. And you can tell by the tone of my voice that it's a little more aggressive. It's one of those things that hurts so bad or hurts so good.
And again, you can see, if you start getting a routine down, you can start doing it fairly quickly.
Oh, yeah.
If
Yeah.
you're getting real serious about it, you might heat it up before you even do these. We've recommended this in the past. This is a Thermatex. This is actually infrared heat. And the reason this is a little bit better, it goes much deeper. Normal heat just goes, maybe penetrates that deep.
Right.
This goes 2.6 inches.
At least, was it, how many times? 10 to 15 times deeper?
Right,
Yeah.
right. Actually, yeah, it was like 50 times deeper almost. Or
I don't think 50.
it was
Bob.
2 millimeters and 60 millimeters, so 30.
30 times,
Yeah,
okay.
30 times. So,
A lot deeper.
and also at the end of the workout, Brad, what you may want to do is you may want to ice. And a quick way to do that is just take a styrofoam cup, fill it up with water, freeze it, and then you just tear the top off so that the ice is exposed.
Right.
I don't have ice in here right now, Brad. We're
Yeah.
simulating.
Right.
And then I usually take my hand and I go like this,
Yep.
and that smooths it out. And then just really quickly, you can cool things down
Right.
by putting it up on the calf there. So
Get a towel so the drips don't go where you don't want them to, but it's a nice way to, as sports people do it all the time.
Now, the thing is with shin splints, I think, Brad, I don't think we need to talk about the other stuff, but the thing is with shin splints, to try to avoid them, one, you know, if you are a runner, don't increase your mileage too rapidly. They say 10% increases, you know, don't go
Right.
1 mile to 5 miles. I mean, the body hasn't had a chance to adapt to it. You want to avoid hills and unlevel surfaces, hard surfaces even, if you're having trouble. And even the camber of the road. You know how when you go down the road and it's got a slant to it?
Right.
You don't want to stay on the same slant all the time.
Right.
So if you go down one side of the road, you want to come back down the same side. I know that's not good safety-wise, but
Well, just tell them that Brad and Bob said to do.
yeah, just don't get hit by a car.
Yeah.
So.
Be careful.
All right, so you know, let us know out there if this works for you. You know, it's just something we're trying, and obviously it's worked for Tom Brady, and they have a whole clinic, by the way, Brad, in Foxborough, Michigan, I think it is.
Oh, really?
Oh no, not Foxborough, Michigan. Where is? Hold on a minute, I got it. Foxborough, Massachusetts.
Your memory's working
Yeah,
good.
yeah, it is. He's not in Michigan. He's over on the East Coast. So.
Right.
All right, thanks everybody for watching.
I wonder where he's from.
Yeah, I don't know.
Maybe we can look it up.
I bet you it is.
No,
Yeah,
we'll Google it
he
later.
talked about his childhood.